I'd like to thank Isarna and the KIMT organizers for giving me this chance to come and lend my voice to persuading you that TGF-β is an important target in cancer immunotherapy. TGF-β actually affects just about every arm of the immune system.
TGF-β is an immunosuppressive molecule, and you can demonstrate all kinds of nice features of immune inhibition. If you look at T cells, NK cells, you name it, everything is inhibited by TGF-β. We are faced with a lot of evidence that we should target TGF-β, and there are various candidate cancers around. I'm biased. I want to develop something for glioblastoma because my patients usually suffer from glioblastoma. Prostate is a topic, melanoma is a topic, some types of lung cancer. So there's a lot of diseases where clinical development would make sense. TGF-β is very critical in maintaining the stem cell pool, notably in glioblastoma, which fits nicely with the overall concept that this is our master molecule that we should target.
So nearly all epithelial tumors overexpress TGF-β, and in many cases where this has been looked at, that overexpression of TGF-β correlates with metastasis and poor prognosis. When we block TGF-β, there are effects both on the tumor parenchymal cells and on the immune cells that affect the immune response of the tumor.
What we know is that TGF-β has a pleiotropic response, and I'm showing this slide to present this. And what happens is that TGF-β can be secreted by many different cell types, as Lalaji was saying, and has different responses. And an important concept here is that the response is different depending on the cellular context. Well, we know, and you have seen, that the signal is quite linear. We have a ligand that binds to a receptor complex that engages a mediator of the signal, which are the SMADs that get into the nucleus to regulate transcription. It's a quite linear pathway with a pleiotropic response.
There's a lot of treatment of vaccination studies ongoing, and I think for most of the vaccination approaches in cancer, it would be nice if we could get rid of the most important immunosuppressive molecule, and this again is TGF-β. So even if monotherapy wouldn't work, I would still make my bet that combination with vaccination would make a lot of sense.
Patients that have high activity of TGF-β, in this case high levels of ligand, do worse than the rest of the patients. So the amount of TGF-β 1 and 2 correlates with poor prognosis, because these will be the patients to be treated with anti-TGF-β treatments.
So just to summarize, I think we can say that TGF-β is a really key immunosuppressive factor, and the fact that it's overexpressed in so many different tumors, I think, makes it an interesting target. And combination therapy with TGF-β antagonists can enhance the efficacy of immunomodulatory therapy and anti-cancer vaccines. So we feel that it's a very important therapeutic target in cancer. Thank you very much.